child life practice extends to the well-being of infants, children, and adolescents, and young adults. Child life focuses on the optimal development by promoting coping skills to minimize the effects of hospitalization, the healthcare team, and any other stressful experiences. By using expert knowledge of child development and psychosocial care, child life practice works to promote optimal development, educate children and their families about health conditions, prepare children and their families for medical procedures and treatments, plan and rehearse coping skills and pain management strategies, help children work through their past, present, and impending experiences, and establish therapeutic relationships with patients and their families to support them through their child and siblings' care. The impact of illness, injury, and health care on patients and their families can be extremely diverse. Important factors that affect this adjustment are families' past experiences with the health care, the patient's stage of development and age, perceptions of their diagnosis, relationship to their family members and their family dynamic, and their family's perception of the healthcare system, and much more. It is the job of child life specialists to assess how these factors affect each family and form an appropriate approach to promote coping. Child life practice uses knowledge of child development to meet the psychosocial needs of that child by addressing misconceptions and fears, anticipate and prepare for impending healthcare needs, and utilize coping skills and pain management strategies to promote resilience and continue optimal development. Patient and family-centered care acknowledges the family as the number one experts on their child. By accepting this undeniable point, child life brings together the essential relationship between the healthcare team, the patient, and the family by establishing rapport with family and advocating for their needs from the healthcare team. By using a patient, family-centered care approach, child life helps ensure that families and patients have a voice in how their experience with hospitalization and treatment will be. It also prevents misconceptions, mistrust, and allows for compliance. Play is an essential component of the role of a child life specialist and in child life practice. Play is the language that children process their world, their experiences, and the modality in which they learn. Through my education in child development, my favorite quote I came across was by Erik Erikson on the benefit of play. Erikson writes, "To play out is the most natural autotherapeutic measure childhood affords. Whatever other roles play may have in the child's development, the child uses it to make up for defeats, sufferings, and frustrations." I love this for its acknowledgement of the child's relationship with play for working through unknown experiences like defeats, sufferings, and frustrations. Each one of these have a unique impact on a child, frequently in ways that the child cannot verbally express or even think through, so they resort to play to make sense of it. Play is a diverse experience and is easily adaptable for each child to address the development and psychosocial needs of the child in their hospitalization. Preparation and education seem to be the meat of child life practice. While all aspects of the child life scope is essential, preparation and education is a qualitative and quantitative variable in measuring the success of child life and assessing in which areas do we see child life generating the most work in. Preparing children for hospitalization, clinic visits, surgeries, and therapeutic procedures is an important element of child life. By using expert understanding of fears and concerns at each developmental level and assessing risk factors such as age, temperament, previous hospitalization, parents' level of anxiety, the child's level of anxiety, the child life practice forms a preparation process that is developmentally appropriate for that child, addresses and encourages questions and any emotional expression, and establishes a trusting relationship with the healthcare team. It is important preparation methods and techniques use a variety of materials that the child can manipulate on. Methods should be hands-on and include visuals such as a child-size, non-threatening toys and tools. Preparation and education must take place in a safe and painless space where the child can feel safe enough to express emotions and ask questions. Death and dying are non-normative experiences that children go through. The role of child life in these experiences is to use knowledge of child development to meet the child where they are in their process of their own death, their sibling's death, or even the death of their parent. Child life creates a safe forum where the child can freely express their wants, needs, and feelings about dying and death. Through the use of developmentally appropriate educational tools such as books, activities, and activity journals, also crafting, child life practice can prepare the child for the death experience and allow the family to maximize the time they have left with their child rather than spending that time worrying about how the child will learn they are dying, or even how they worry about it, or if they have any questions they don't feel like they can answer. The education and preparation in hospice encourages being honest about death and dying and explaining so in an age-appropriate way. Coping skills and pain management techniques are important to incorporate during educational moments. By doing so, child life brings peace to these families in their last precious days with their loved one. Child life also has the opportunity to provide legacy item creations for the families. This support is amazing in that it allows the family to have a final piece of their child before they pass. The presence of child life in hospice removes the responsibility of having to educate their child on their impending death or siblings' death and allow for parents and families to simply be parents and families. Self-care emphasizes the ongoing relationship that you have with yourself. Just like it is important to nurture the significant partner relationships, sister relationships, parent relationships, and parent-child relationships, it is important to nurture the relationship you have with yourself. Like you wouldn't let your job interfere with your relationship with your parents, you should try your best to minimize how it interferes with yourself. While it is almost impossible to completely remove yourself from the work that is child life, there is definitely a way to guard your heart while still doing your job. For example, matching affect, maintaining professional boundaries, and separating work from home life are all ways to guard your heart. Bereavement support is an aspect of child life where it is essential to practice self-care. A child life specialist does not have to be working in pediatric hospice to support a child or a family through a death experience. In the hospital, providing support during a death experience to parents and siblings is also important. Providing opportunities for practicing coping skills with siblings and parents can be done alongside preparing the child for the impending death. In these experiences, there is an intense amount of emotions. Keeping the professional boundaries during such moments can help protect you from these experiences. Also, knowing how you grieve and how you can care for yourself during that grief can be beneficial to prevent the burnout that can threaten your strength. Being confident in your strengths and also being willing to work through your weaknesses can provide a sense of empowerment in any situation. Holding these experiences, sad and victorious, close, but never allowing them to haunt you, I feel like, is how I can manage my emotions by allowing myself to stay close and involved, but not over-involved. The Association of Child Life Professionals advocate for the work of child life practice by bringing attention to the success and impact of child life services. I know that the ACLP will continue to improve the use of the child life professional by for example, most recently being the changes made in the certification exam to be the most preparatory and relevant to the first few years of being a child life specialist. This shows that the ACLP listens to its members and produces content that this community of professionals want. The ACLP also advocates for child life services by showing with tangible evidence how it improves quality and outcomes in pediatric care. Future research can also show that child life services help contain costs by reducing the length of stays and decreasing the needs for anesthetics. Patient and family satisfaction, as well as feedback from healthcare teams, confirm the positive effects of child life practice. Child life continues to prove usefulness in all areas of the hospital, not just in typical pediatric application settings. Most recently, child life specialists have proved to increase the quality of care and outcomes for patients in pediatric burn units. This shows them enormous outreach capabilities of child life. I believe the future of the child life profession will continue to thrive and flourish by proving the necessity of this practice in every aspect of the hospital and become a staple to patient and family-centered care.